Good afternoon, this is Deb Brucker from UNH, and I'm pleased to introduce our panel on scientific methodological issues in disability statistics. We have one substitution today. Dave Wittenberg will be presenting instead of Jason Markesich for Mathematica. So this is a very session that's geared towards people that are data geeks to the nth degree. So hopefully it'll be something that you'll find useful. I'd like to introduce Kim Phillips first from UNH.
Thank you. I will be talking about a study, surveillance of people with IDD using Medicaid and commercial claims. Do I advance my own slides?
Yeah,
Yes.
Should be a little remote control.
It looks like that.
A remote control. Is it up top?
Oh,
there it is.
this tiny walkie-talkie thing, cool. This research was supported by the Centers for Disease Control and Prevention, and it appears in a peer-reviewed journal article that is currently under review that's written by Phillips, Rickert, and Houghtonville. The purpose of this study is to improve health surveillance for people with IDD. In doing so, it responds to a call by Cron et al. In 2010, and we do so by replicating an algorithm to identify people with intellectual and developmental disabilities using ICD-9 diagnosis codes. The algorithm was developed by a group of 5 states in cooperation with the CDC and is being published currently in press in the American Journal of Intellectual and Developmental Disabilities by McDermott et al. Our study replicates and extends these findings by also bringing in private insurance claims and using people without IDD as a comparison group. The data that we used is from the New Hampshire all-payer claims data files from the years 2010 to 2014, which we accessed through a limited use data agreement with our state. We created 2 broad groups: claimants who had Medicaid insurance only, and then another group who had private insurance, any private insurance. They may also have had Medicaid, but not exclusively. We did not use any Medicare data, and anyone who had any Medicare was excluded from the study. So we stuck with people who were ages 0 to 64, and they had to have eligibility for at least 11 of 12 months of the calendar year during the study period. We also used diagnostic criteria to identify IDD. They had individuals had to have at least 1 inpatient or 2 outpatient visits that were at least 30 days apart with an IDD diagnosis. And then a mutually exclusive algorithm was applied, which I will describe in a moment. Our final sample represented 76% of the total New Hampshire population of people under the age of 65 in 2010. Another 7% of people under 65 had no insurance, so we really captured a great deal of the population. The conditions that we looked at are listed here in the order of the mutually exclusive hierarchy, and they include chromosomal anomalies, autosomal deletion syndromes, and other congenital anomalies. That's a broad group that includes conditions such as Down syndrome, Edwards syndrome, Prader-Willi, Fragile X, and many others. Cerebral palsy was next, then pervasive developmental disorders and autism. And then we had 3 non-specific IDD categories, meaning that they were mild intellectual disability, moderate to severe intellectual disability, or unspecified intellectual disabilities. The mutually exclusive categories mean that if someone had more than one condition, this is how we separated them and to which group they were assigned. So it was in that order. And then cerebral palsy and PDD autism are highlighted because the CMS Chronic Conditions Warehouse lists groups of codes to identify specific populations. And the non-highlighted conditions, in other words, all those except cerebral palsy and autism, are included in CMS's intellectual and related disabilities. And then the other two, cerebral palsy and autism, appear separately. So these were all grouped together for our study. First, in the results, I'd like to share just general demographics comparing people who had Medicaid-only claims to people who had private insurance claims. And what we see is using chi-square tests, these, although the difference varies, these are all statistically significantly different. People with Medicaid-only insurance were more likely to be female, much more likely to be children, ages 0 to 17, and much more likely to live in rural areas, although the majority of all claimants lived primarily in urban areas. Still, those with Medicaid were more likely to be rural. Now looking at IDD prevalence, comparing Medicaid to private insurers, we see that the prevalence of IDD, as we would expect, is much higher in the Medicaid group, 4.3% versus 0.5% among the private insurance group. But what's interesting here is the number. So we get 80% more people with IDD that we find when we include private claims, and that's a significant number. Differences in the specific and non-specific IDD conditions. People with Medicaid only were more likely to have cerebral palsy, less likely to have Down syndrome or autism PDD, and more likely to have an unspecified or mild, moderate to severe intellectual disability. Now looking within the Medicaid beneficiaries, looking at IDD versus no IDD. Again, using chi-square tests, all of these statistics are statistically significant. So people with IDD who are in Medicaid are more likely to be male, they're more likely to be adults, and again, though a minority are rural, people with IDD are more likely than people without to live in a rural area. Looking at people with and without IDD in the private insurance group, we see again that people with IDD are more likely to be male. This time they are much more likely to be children, and they are more likely to be urban. And finally, looking at all people with IDD and comparing the Medicaid group with the private insurance group, we see that in Medicaid, even though most people with IDD are male, in Medicaid they're slightly more likely to be female, much more likely to be adult, and again, more likely to live in rural areas. In sum, we believe that including private insurance claims when surveilling people with IDD is a great benefit over Medicaid alone. First, because it allows us to compare and contrast the IDD population by insurance type. And next, because it offers a much more thorough examination across gender and age spectra. These two populations differ in ways that are relevant to public health and social services policy, especially based on what we know about Medicaid, that Medicaid recipients tend to be lower income, live in areas with less access to health care, and often have less choice of providers. And finally, these findings are relevant to healthcare policy, especially when, well, these findings, but using claims data more generally, especially when including healthcare utilization, healthcare cost variables, which are some of our next steps. A few limitations need to be mentioned. Claims data do underrepresent the population of people with IDD, partially because there is no single variable that providers can check off to denote that people have IDD. Also, they may miss milder impairments that have not yet been diagnosed. And of course, this method excludes people without insurance. The data set that I'm describing is missing 8 months of data during the study period. These data are just not available in our state right now. And finally, unfortunately, like in some other states, there is no reliable race or ethnicity data in claims in New Hampshire. So next, we have continued collaboration with 7 states right now that are funded by CDC to continue similar types of investigation of people with IDD. There's an intervention that's planned that all 7 of us will be collaborating on, or I should say coordinating, so that it's the same intervention in all 7 states. In New Hampshire specifically, we will always continue to pull in the private claims for the reasons described during this talk. We'd like to investigate quality of care markers, aforementioned utilization and cost variables, and we'd also like to expand this health surveillance to look at other disability populations. Thank you.
Thank you, Kim. I think you'll find, as Kim discussed, this is an innovative way to try to gather some information about a population that it's hard to get data for using some of the national surveys that were mentioned earlier in the day. And we will have time for questions at the end of this session if you have specific questions for Kim. So next, I'd like to introduce Eric Lauer, who's going to compare the 6 disability questions that are included in the American Community Survey with the Washington group set.
Good afternoon. My name is Eric Lauer. I'm a researcher at the University of New Hampshire, and I'm here to present some of our work comparing disability question sets. National surveys are considering changes to the annual inclusion of standardized disability identifiers, reinvigorating the priority for disability research policy and funding agencies to understand the comparability of question sets. These question sets include those led by the United States National Center for Health Statistics to identify people with disabilities, also known as the Washington Group Short Set and American Community Survey disability identifiers. The ACS and Washington Group question sets are national and international efforts, respectively, to develop standard disability question sets for data collection efforts. However, despite these efforts over the last 2 decades, there has been limited research to understand and compare these questions in disability research. The ACS and Washington Group have 5 similar questions that we have been comparing. They are designed to identify people with disabilities based on difficulties with hearing, vision, cognition, ambulation, and self-care. The ACS questions were developed and field tested by the Census Bureau. They were nominated by the Department of Health and Human Services in response to the Affordable Care Act mandate to be included in national surveys. The ACS questions also have an independent living question, which is not included in the analyses presented today because it does not have a comparable Washington Group short set question. On the other hand, the Washington Group short set is part of an international effort to develop disability identifiers for population-based surveys comparable across countries. The Washington Group short set also has a communication question, which is not included in the analyses presented today because it does not have a comparable ACS question. As a follow-up to the background I just presented, I'd also like to note that an additional methodological imperative for comparing these question sets involves the responses. The ACS question responses have 2 levels, yes or no, while the Washington Group questions have 4 levels, no difficulty, some difficulty, a lot of difficulty, and cannot do it all. Because the Washington Group questions have 4 levels, understanding how the Washington Group responses should be coded compared to the 2 levels in the ACS responses will be important for research discussions moving forward. The ACS and Washington Group questions have similar development goals. They're designed to be policy relevant with lengths appropriate for censuses and to be comparable across populations. Both have development narratives emphasizing that these questions are intended for general disability measurement. They are not designed to be a comprehensive disability assessment for individuals, nor are they intended to identify a true disabled population or act as some kind of gold standard. In addition, discussions surrounding these questions also recognize that they are limited by the data collection procedures of the surveys that implement them. The work presented here uses 2010 to 2015 National Health Interview Survey data from their family disability and functioning and disability files. For disability estimates, we compared ACS responses of yes to Washington Group responses of a lot of difficulty or cannot do. We estimated prevalence in 95% confidence intervals in the form of percentages that take into account complex survey design methods. Our broad exploratory null hypotheses were that disability prevalence would be consistent across types and for multiple disabilities, and that demographic and social factors would be consistent for people reporting disabilities using either question set. Today I will be presenting the results of some of our comparisons of disability prevalence by disability type and for multiple disabilities using both question sets. I will also present the prevalence of social factors for people reporting multiple disability types using both question sets. This slide presents disability prevalence in the general population for civilians ages 18 and over by question set and type. In this slide, the Washington Group questions are coded dichotomously, and they compare people reporting a lot of difficulty or cannot do at all responses to people in the Washington Group questions to people reporting yes to the ACS questions. We found that people consistently report a greater percentage of disabilities using the ACS questions, and this was significant for all types. In the slide above, the white bars are the ACS responses, and the dark gray bars are the Washington Group responses. Importantly, the prevalence pattern is consistent except for hearing and vision. People report the most ambulatory disabilities and the least self-care disabilities for both question sets. This slide presents the distribution of specific disability types among people with disabilities by question set. More than one disability type can be reported within each set. This slide differs from the previous slide because here we are estimating the distribution of disability types among people reporting disabilities. For example, using the ACS ambulatory question, in the previous slide we found that 7.4% of people report an ambulatory disability in the general population. And in this slide, we found that among people with disabilities, 54% of them have an ambulatory disability. And that would be denoted by the white bar on the left of 51.4%. Consistent with overall estimates from the previous slide, the ACS questions find substantially larger prevalence type estimates. The overall pattern was also the same, with the largest prevalence of ambulatory and smallest prevalence for self-care. Among people with disabilities, 54% have an ambulatory disability using the ACS questions, compared to 10% using the Washington Group questions. Also, among people with disabilities, 15% have a self-care disability using the ACS questions, compared to 1.5% using the Washington Group questions. This slide presents data on multiple disabilities. It presents prevalence mosaics of disability type among people reporting 1, 2, 3, or 4 or more disability types. These are stacked bar charts which illustrate the percentage of each disability type differentiated by color. I will not be covering specific prevalence values here. The slide is intended to present the overall consistency of prevalence estimates between question sets. The values are included here in case people download the slide. We combine categories of reporting 4 or more disability types due to small sample sizes. Statistical significance is denoted by a star to the right of each pair of bars. The column on the left, labeled 1, shows estimates for people only reporting one disability type. As expected, based on the previous 2 slides and set of estimates, these percentages were significantly different for the majority of types: ambulatory, cognitive, and hearing. Ambulatory was always the most prevalent disability type, and these numbers reflect the large differences we saw on the previous slides. The columns on the right, labeled 2, 3, and 4 or more, show the estimates for people reporting multiple disabilities. The majority of these estimates were non-significantly different for people reporting 2, 3, or 4 or more disability types. Only 2 of 15 estimates were significantly different. These findings suggest that percentages of people reporting multiple disabilities across question sets may be similar. This slide presents percentages of social factors among people with one or multiple disabilities. The bars are prevalence mosaics of social factors among people reporting 1, 2, 3, or 4 or more disability types. These are stacked bar charts which illustrate the percentage of each factor differentiated by color. The prevalence of social factors was non-significantly different for almost all comparisons between ACS and Washington Group questions. Only labor force participation was different for people reporting one disability. These results also suggest that social distributions across question sets may be similar for people with single or multiple disabilities. Our ongoing study of the ACS and Washington Group questions has found that disability prevalence varies significantly dependent on question set and type, with the ACS finding higher prevalence of disability than the Washington Group, specifically when the Washington Group questions are coded to define disability as having reported a lot of difficulty or cannot do for specific functions and activities. However, our work has also found that demographic factors are distributed consistently across question sets. For multiple disabilities, estimates are similar for most prevalence, demographic, and social factors. These findings support our ongoing work showing that the ACS and Washington Group questions, short set questions, can be used to study similar hypotheses, especially using multivariate analyses taking into account demographic and social factors. Further research and discussion is needed regarding the highly different disability prevalence estimates produced by each question set. Thank you.
Thank you, Eric. Next, I'd like to introduce Dave Wittenberg from Mathematica to talk about how we can use behavioral science to improve survey participation. Dave.
Oh, wow. I guess I got to work on my intros. One thing that I'm going to try for this last session, because I realize I'm in the last session of the panel, of the last panel, is I want to get some audience participation in here because, well, I'm talking about a survey. And so the first part of the participation is, has anybody seen the movie called Being John Malkovich? Raise your hand if you have. Okay, think about this presentation as me being Jason Markesich. Yeah, it's going to get worse here, folks, because poor Jason's at home with the flu, and he's probably getting sicker watching me do this. But this is work by my colleagues. What's that?
Or both.
Or both, yes. This is work by my colleagues, Jason Markesich, Ryan Callahan, Jesse Chandler, and Amy Johnson. And so what I want to do before getting into the details is there's about 45 people here. I want to ask you a few questions, and I want just participate. Doesn't matter if you get it right or wrong, just participate, engage here. Humor me. If nothing else, I want to see people move. So the first question that I have, and this is all about cover letters to a survey. Raise your hand if you think cover letters would matter, how you phrase that cover letter. Do cover letters matter at all? Raise your hand, just out of here. Yes. All right, there's about 60% of you that look like, and based on my non-scientific processing, that think cover letters matter. 40% of you, I just want to let you know, well, not unfortunately, you're wrong. So that's the first question. So cover letters actually do matter for this presentation. That's one thing that I want you to take out of this. The second thing is, well, what matters about cover letters? So let me give you a couple different scenarios. And there are two, or actually there are three. The first is, should you just be concrete and get to the point, get to the ask? The second is, should you personalize it to the person? Or three, should you do a combination of both? So let me repeat those options. Be concrete, right up front. Number two, personalize. Number three, do both, personalize and be concrete. So who thinks one? No, nobody. Oh, there's one. Thank you. Thank you, Moderator. Who thinks two? Who thinks three? Okay, you're all wrong. It is actually, believe it or not, it's being concrete and shorter. That's what matters in a cover letter. And the analogy that I want to use here is think about how you write an email and how you receive an email. A lot of times people don't have a lot of time to process emails. They want to get right to it. That is the punchline. So if you want the punchline and you want to sort of tune out to the rest of the numbers that I'm getting here, cover letters matter. Being short, sweet, and putting the ask matters right up front. And even if you don't like writing cover letters, I think that this could even help you in your day-to-day life of how to think about emails. So, let's see if I can do this. So how did we do this? This is taken from a cover letter for the National Beneficiary Survey, which is a survey sponsored by the Social Security Administration. Mathematica has conducted 6 rounds of it since 2004. And so the good news is that we had a cover letter since 2004. And so we decided, well, let's play around with that cover letter and let's run different types of experiments on this cover letter, on this survey. And what the National Beneficiary Survey is, it's a nationally representative sample of Social Security disability beneficiaries. That is those who receive disability insurance and supplemental security insurance income. And the reason why the NBS is really important is because a lot of times program participation tends to be underreported in some of the national surveys, and so Social Security funded the NBS to get a much deeper dive of who these beneficiaries are. So a little bit about the NBS. It has a dual mode administration, telephone interviewing and going door to door with in-person modes. There's a bunch of methods to promote response rates. They include incentives, they include advanced letters, they include Spanish language interviews, they include assistive technologies, and they include assisted interviews and proxies. So, the context, and you heard a little bit about this this morning about why this matters. And I thought Julie's presentation this morning really picked this up very well from the NHIS. And if you remember from Julie's presentation, there was approximately 250 indicators that they had from the National Health and Interview Survey. So this is really a difficult thing to do. And as you'll recall from Julie's presentation, the survey mode time was increasing gradually over time. We have the same problem with the National Beneficiary Survey. And what you're seeing in this chart is the various metrics that we have for participation. We are seeing from 2004 to 2015, call-in rates are dropping, completion rates are dropping, refusal rates are up, attempts per complete are up, attempts per non-complete, even the people we can't get, up, and then interviewer hours to complete, up. So there's a need to think about this differently from 2004. And this is, as you think about the NBS, this can apply to all sort of national surveys. The landscape of which we're collecting data has fundamentally changed. And I think that that's really important as you begin to contextualize sort of what is the broader message from this. So Jason and his team's strategy was, how do we leverage behavioral science? Which is just a fancy way of saying, how can we tweak small things and see what impact it has on different outcomes from the survey? And the study was how people make decisions in a complex world where making the right decision is often difficult. And some of the factors that we thought about in terms of the cover letter was there limited attention span? Was there forgetfulness? Was there procrastination? These are all things that we can associate to in our daily lives as we go through our mail, or even as we go through our email. So this is, it's too bad this is hard to read, so I apologize for it not being very accessible, but this is what the original letter looked like. And the first thing that I want to point out is the first paragraph. It's very, very much safe, and it's almost bureaucratic, and the tone is not personable. So that's how we came up with, let's make the tone personable. The second thing, and I think that this is really, really important, is the two yellow parts. And these are what I call the asks of the survey. The asks of the survey is a representative from the company will call to speak to you in about a week. And then the second yellow highlight reads, if you want to set up a time to talk or need help to take the survey, please call Mathematica at an 800 number or send an email. So think about that for a second. We have told the person receiving these letters two different things. You can either be called or we'll call you. And so somebody reading this is likely saying, yeah, they'll just call me. And so there isn't a concrete action step. So that's where this idea of should we be concrete, should we be personable, or should we do a combination of both come from. So, and these are the four tests again. And the original test was do cover letters matter, which is we're going to use that original letter to approximate a quarter of the sample. A quarter of the sample got what we call the concrete, what I'll call the short and sweet version of here is the ask, and I'm going to show what that example looks like because I think it's a best practice. And then there is personally relevant, incorporates language that explains how SSA would like you to tell us about your experience, to try to motivate people to say, look, I want to participate so you can hear my story. And then the final one is concrete and personable, which combines items 2 and 3. So here's the concrete letter. And the short story is highlighted in yellow, which is, you'll notice immediately, we say, please call them at the toll-free number before 10 p.m. and do one of the three things. Take the survey, schedule a time, or refuse us. We tried to be very, very clear. And I think what also is notable is not only the text, it's the use of bullets, being very, very clear in terms of the options, which is very different from what you might recall of the block text format. So the methods, essentially it's fairly straightforward in terms of a random assignment. We've got 4 different experiments. We randomly assigned 5,000 cases to one of the 4 experiment groups. We mailed the advance letters first class. I have to admit, I'm not sure what the difference between first class and other is, but then we did not conduct any outbound dialing for 8 days after the letter was mailed. So this is really important because we want to make sure the dosage of the intervention is working, meaning was it the cover letter that was having an effect versus was it the cover letter and a combination of an immediate call? So the key outcome was whether or not people called us. So, and this is the punchline, so if you've drifted off during the presentation, you want to come back in, this is the slide to pay most attention to because it has the primary finding from the study, which is this slide shows the percent of initial contacts that were call-in users. These are the people that got each of the 4 letters and how many called back. 4.7% of the original sample called into the toll-free number. 7.2% of the concrete sample called into the toll-free number. 5.3% of the personally relevant sample called into the toll-free number. And then 6.7% of the concrete and personally relevant called into the toll-free number. So what does this mean? Well, first of all, the biggest bar wins. So the concrete letter had the biggest impact. That's not to say that concrete and personal still didn't work. That's still a much better letter than just the original letter. So these things actually matter. And then personally relevant, you'll see there's relatively little difference between the original form and just going personally relevant. And my hypothesis of why that is occurring is because it's hard for people to read that long of a letter, absorb it, and then figure out what to do. They want to see it immediately. And I associate with the MBS respondents because that's how I personally respond to email. So this is a little bit more busy, but what this chart shows, and I apologize that it is so busy, is it shows of the call-ins who actually completed the interview. So it takes the next step. And there are actually 4 categories after people call in. They can complete, they can set up an appointment for a further follow-up call, they can tell us to get lost, which is the refusal, and then they can tell us other. I don't know what other means, but there's some other category that people fell into, which is a very small category. And what you find is most people fall into the complete or appointment category, but what's really sort of provocative about this is that still among those who called in, among that 7.2% who called in, a higher proportion of that group was much more likely to respond to the survey, 56% relative to those other groups. So, behavioral science tips to improve your communications. This is the summary slide. First of all, apply a skim test, which is read your cover letter and think, can I absorb this information quickly? Second, put your bottom line upfront information, okay? Put the ask up front. Third, use simple, non-linear, non-technical language. And fourth, provide a clear single next step or an action step for a reader to take. In some ways, you look at these conclusions and you say, of course, right? But the challenge is, as you design forms, whether they be the cover letter, whether they be the call-in script, whether it is the survey itself, you don't know what you don't know until you start talking to the population. So there's actually a fifth thing here, which is experiment, particularly when the cost of that experimentation can be low, to make sure that you get the right information, because these effects, getting the letter right, even though I'm saying use a concrete letter here, that is not exactly an easy thing to do the first time. Oftentimes you have to test it with the population to know what works and what doesn't work, particularly when dealing with sensitive questions, whether it be about your disability status or your income status, or in the national beneficiary case, when you're interviewing populations of Social Security disability beneficiaries. So that is it. And if you want to contact me, this is not my contact information, but you can reach Jason. Thank you very much.
Thanks, David. We have 20 minutes for questions, if anyone has any questions. We have mic runners available for any of our panelists. If not, Andrew will probably make up a question, so please ask some questions.
I'll start one up. So Dave, in your presentation just now, I mean, this is great. It sort of follows the general concept of don't bury the lead. Mm-hmm. But also what's interesting to me is, you know, and I don't know if Mathematica has to go through this, but if you're at an institution, you have to go through your institutional review board, and they're going to review that letter, and they may have all sorts of, you know, advice to not follow the way that you're suggesting. So got any advice there, or can you put out a paper that we can give to an institutional review board to sort of suggest them follow it?
This is a fantastic question, because it's not only IRB boards, but it's often Office of General Counsel. And just when you go through a review process, you'd be surprised at how much surveys changed. And I think if you listen to our federal panel colleagues today, they really emphasize that, you know, they had to have pieces of legislation to justify even the question, so let alone that. I think the best thing that you can always do, and this is a constant reminder to ourselves, is to bring an evidence basis to these things. And so I think that this study helps us. There's also there is a book on web and mail survey that is best practices by a person named Dillman, who's literally written the book on these things. And so when you submit these things to an IRB, I think it's important to remind them that these are evidence-based practices. And because otherwise they will, when I say they will naturally look to protect people against undue harm. And sometimes as you look to protect, you add words. And when we should perhaps be doing the opposite. And this not only refers to surveys, but this also refers to, say, Social Security disability program rules.
Hi, Joanne Schneider again. Quick question for Kim and then something for David. Kim, when I looked at your data, it said to me age cohort, as in the kids are, yeah. Okay, so did you have something about whose insurance it was on there?
Thank you for the question, Joanne. No. Is the
Okay.
answer. I don't have information on who is the holder of the insurance.
Okay, great. David, I'm going to show how old I am again. But, you know, when I learned Survey 101, we were still having the sponsor letterhead, and that was really, really important because who on earth is Mathematica? Yeah. So I'm wondering if that was tried. I'm also wondering, I'm just curious, you know, I presume you ended up calling a large percentage anyway. What percentage was it? And what happened to the email? I would think a lot of people would email in as opposed or text in or something. So.
Yeah, good questions. I just want to refer to my notes here. I got to refer to the letterhead. I have to admit, and I wish Jason were here, I cannot recall if this went out on Mathematica or SSA letterhead. I think it may have gone out on SSA letterhead because we are cognizant of the fact that if they just see Mathematica, it'll be perceived as fraudulent. I mean, that's the biggest issue, whether you're running a demonstration or a survey. So I'm pretty sure, let me verify by email, but I'm pretty sure that's the case. The second question that you asked was about using telephone follow-up and in-person. Yeah, I mean, what percentage did this knock off? This knocked off 5 percentage points off of base. So we're not talking about a transformative change in terms of like how people respond to the survey. We are talking about a large monetary savings because people called us, but the numbers that Jason had in here were about 7 or 8% off a base of a response rate that was in the 60s. So still a huge in-person and telephone follow-up. So I don't want to say that if you get the cover letter right, you got a great survey. The cover letter is only one part of it. But this is a place where you can save. And Joanne, remind me of the third question. For legal reasons, they will not allow electronic messaging for some of this stuff. And this, if I can editorialize, this is where I'm so struck by Julie's graph that she showed earlier of how much time it takes to take a survey and how we all think about surveys in our own life. I think we're going to have to start moving to these alternative accessible formats to increase the response rate and start being creative and perhaps stop saying I've got to just keep this question or these sets of questions. Like we have to think about what people are going to respond to, which increasingly more and more these days are shorter, sweeter surveys that are also convincing, that they don't feel like they're going to lose personally identifiable information, and that protects against that. And so it's figuring how to get that balance with also the needs nationally to continuously track the important time trends that Andrew and Eric have been talking about in the compendium in these trends, so we can see how we're doing nationally and see what the gaps are. So there is that balance. But when you look just at that base number that Julie sent of, the presentation taking, or the questionnaires taking over an hour and a half, the question that you have to ask is that sustainable in 10 years? And that's where innovation is I think, really, really important. And that's where I know, Andrew, some of the folks in your group and some of the folks in our survey group, and I know folks at the census are also very interested in this, but it's like moving a big ship.
One thing for the in the room and possibly change this. I mean, to me, yes, there's a length issue, but the bigger issue is I don't answer my phone anymore because 90% of calls are scams.
Yeah.
That's the huge issue.
It is, and what I didn't show is the response rates in the NBS have been dropping for the reasons you know, but the same thing is happening in NHIS. And there's an important thing to also remember, too, when you're doing survey design. A lot of times we're so focused on response rate of like, oh, we got to get at least 80% response rate. And that sounds like a great number, but there's other factors you have to think about as you're surveying, because a 60% response rate may be just fine if that 60% represents the overall population you're trying to target. So it's thinking about what those survey goals are as opposed to saying, oh, 80 must be better than 60. Because 80 is not always better than 60 if your 80 doesn't represent the population you intend to target. And this tells us something about perhaps where we should invest our most intensive resources in doing follow-up interviews to get that representative sample.
So Dave, this is kind of a follow-up question. So with the MBES, you have the ability to merge in records from their Social Security, from the 831 disability determination file. And do you know so the big issue is it representative in the end, right? And so you know a lot about who you're trying to represent.
Yes.
In fact, everybody you want to represent. Do you know if there's any differential, and Jason can follow up with this later, if there's differential response rates overall or to this kind of letter experiment for people with different disability, underlying primary and secondary conditions? Because people with cognitive impairment, and I know you guys have experimented with different proxy rules and assistance, not just pure proxy, and that research has been published. But I just wondered if this kind of research and response rates are considered when sample weights are developed, or can you give a little bit of talk about that?
They are. I don't know what the specific response rates are by various impairment groups, but the intuition is there are certain groups for which surveys are more accessible than other groups. For example, one group is if you cannot reach somebody in an extreme rural setting, that group is very, very expensive to interview, and you have to do sort of a cost-benefit analysis. And similarly, there are likely differences across impairment groups. The huge advantage we have with the National Beneficiary Survey that the census doesn't necessarily have with general target populations of people with disabilities. We know in the NBS how many disability beneficiaries there are. And so we can adjust our sample weights to the impairment demographic distribution of the population so that we can make non-response adjustments and have some confidence of what those sample weights should be. That doesn't say that there's still not problems with weighting that goes on and some potential problems with imputation, but we have that built-in advantage, at least with that survey. But in answer to your more direct question, Andrew, I'd have to let Jason talk a little bit more about differential by specific impairment group. I can see where that would be particularly important for national surveys where you don't have that benchmark. And so.
Hi, David Bahar with Communication Services for the Deaf. The presentations here have been quite fascinating, and I wanted to pick your brain a little bit about the deaf community. Now, we do know that the deaf community has specific challenges finding employment. A lot of them are on SSI and SSDI in the meantime. So I'm wondering if there's any, any ways in which we can figure out why that may be, if there are any factors that are contributing, for example, the inability to find work, leading them to rely on these types of supplemental income. Is it because of lack of communication access before they are even getting an interview, so that they're not being offered the interview in the first place? Is it a lack of accommodations actually on the work site? Or is it something that even precedes those questions, like access to quality education? So I guess that then leads to the topic of today, which is about how you could disseminate a survey to the deaf and hard of hearing community in America regarding their ability to apply for and to get sustainable employment, where we can understand the factors that are really influencing the on and underemployment that we see within in the community. So I guess that leads to two questions then for you. What kind of questions do you think what kind of questions have been asked, if any, in the past that might help us get to an answer to that quandary? And then would you have any advice for those of us in the community as to the types of questions we might want to ask on a future survey that would help us better understand those issues?
Yes, I guess that is for me, right?
Yeah.
Sorry. Good question. I'm going to give perhaps unsatisfying answer to number one, but I'm going to try to answer it anyway. So with the national beneficiary, the beneficiaries are already on the program, so the factors leading up to their entry are not necessarily well understood. And one of the challenges is there's a lot of unobserved reasons why somebody might come on to the program. And in the case of Social Security disability benefits, I have no doubt that there are some very impairment-specific reasons for the deaf community and hard of hearing community that come on to Social Security, but there are also many other factors that play into that environment that I would be careful in painting it with a broad brush, because environment really matters, and there are big state differences in application and allowance rates by states, and even within counties. And if you think back to the presentation this morning by Lewis, there was cross-county differences in participation of disability. That's true on DI participation, and we haven't broken down your question finely enough to say this is where the deaf and hard of hearing folks would land. I mean, the way you might do that is take a scatter plot of Social Security disability beneficiaries and take a look at where their distribution is just in the United States. And that is where I'd like us to eventually go with administrative data. I mean, we have an understanding of why, as a broad group, what some of the constraints are, what some of the issues are of returning to work when they're on the rolls. But to get at your question, we're not quite there, because it's a very impairment-specific issue, but it's combined with an environmental one. So I wish I could answer your question a lot better and say, yep, it's the employers, it's the accommodations, it's this, and this. I couldn't do that with what we know right now. Your second question, I'm going to steal from a lunch conversation that I had today about what you can do. I was talking to a woman at lunch who designed an Amputee Survey for her constituency. And is she still here right now? I'm wondering if she's here. Oh, over here. There you go. You may want to talk to her. Is Melanie, is that right? I got it right. Okay, I called her Allison at lunch. It was bad. Melanie's designed a survey and she got a response of 700 amputees nationally, and they leveraged their network. And I think if you could leverage the deaf network, you can start collecting data in different ways. And this is something we haven't gotten into a lot today, but designing short surveys. They use Facebook, electronic mediums, and Melanie, you could probably describe this more if you'd like, but 700 is a large number for an amputee community, and they got it because I think they were concrete to the point, but they also they talked about a topic that amputees want to talk about. So that would be my recommendation for how to design a survey to get feedback from your community so you could put data behind it. And so that would be my suggestion for going forward, but that's not really my idea. It's actually the groups that I stole from at New. Does that answer your question? Yeah. Thanks.
We have time for one more question if there's anyone before Andrew.
Cut off. They cut me off. I actually have a response to that. I would also, if I was thinking about designing a survey, I would go to the Canadians and the Australians and the UK. If you're doing English, starting off with an English version because they have some awesome, Stats Canada has some great surveys that they've developed over the years. Australia, I'm not so sure. All right, that's it. Rachel's in front of me from Australia.
Okay. So I think it's time for our concluding remarks from Dave Wittenberg.
I felt like I got double the applause from the first presentation. I'm not sure if that's an impact or not. So, I realize it's 2 o'clock or 1:57, so I will try to keep my closing remarks brief, but I do want to synthesize what we learned across sort of 5 areas. The first is what I'll call the first session, which is the roadmap. The second session is the federal agency session. The third session is what I'll call data collection broadly, about how data collection methods can inform how we interpret the data. And then there's this fourth section that I'd like to talk about that I had a very engaging conversation with on lunch is translation. And where do we go next is really question 5, which is sort of one of my favorite questions of the day. So with that sort of 5-tiered question, in the roadmap discussion, I love questions that make me think and just pause, and sometimes they're the simplest ones. And there were 2 questions that were asked. They were like, what do we do with these data? This is great. You've presented us a lot of information, but if you've just given us a lot of information, what is our action step? How do we do this? And the second question I really liked is, what was most provocative to you? Those are great questions, and those are questions that research teams should always be pushed on. And this is where what I think Andrew referred to as the users versus producers have to engage to sharpen that message, because data matters, but packaging of the data really, really matters a lot for it to be effective. And I think what we learned in that first session is one of the takeaways that you have from that is county and state variation matter a lot. When we think about people with disabilities and we think about these broad trends, those national trends have a lot of county and state variation behind them. And that has implications for how we think about acting and responding, particularly for the advocacy community, I think, in terms of thinking about, well, where do we go first? Trying to use these data as a starting point, and then pushing the data, saying, okay, maybe I have a county question or I have a state question. Where do we go next? And thinking about how to design things. And it's not only looking at the states where there are biggest problems, it's also looking at the states that are doing pretty well. What's going on in the North and Northwest that's not going on in the South, per se? Or even, to Lewis's point, why are the gaps so large in states like New York that are so large? And so are there lessons that we can take, particularly from the qualitative stuff in those states where the advocacy community might be so close to the grassroots level and understand what the program and policy environment is that further leverages these data? So that is a very powerful use, and the compendium and the appendix of the compendium didn't always do that. And so I would treat this compendium almost as a starting point, as a leaping off point to further push the questions and make sure the research is held accountable to answering those questions. So when we say, so what was provocative? The other thing that I found provocative also from today Andrew, your association in Michigan of kids under the age of 5. At first, I wasn't sure where you were going until you said lead poisoning. I was like, oh yeah, the whole Flint, Michigan problem. And I think that these things that are playing out in the data and using these data as an evidence basis to point out problems, but also to think of solutions is sort of the lesson from the first one. From the federal agency response, I think one of the big things to really take away from the presentation is that there's an increasing use of websites that sort of complement the compendium, but also I think more fundamentally, you can see when the federal agency staff were talking the challenges of designing survey, whether they be employer survey or individual-based surveys, and some of the things that those staff have to do to get the questions on the survey are very, very challenging. And trying to support those staff, not only in finding the questions that you want, it's like finding the good ideas, but there's a Freakonomics episode for those that listen to that podcast. It's also about killing bad ideas. If the questionnaire gets too long, it's figuring out, okay, I've got a budget constraint, which is I might have 20 minutes instead of 50 minutes. What is the best thing that I can learn from these surveys, and how do I do this? And so I think understanding that second takeaway I take from that is what is the federal agent problem to designing that survey and connecting it to the beneficiary. The third section, which is the one that you just heard, it is really talking about the comparison between these different disability definitions that are fairly close, Washington group and the ACS, and understanding how they're similar and where they're different. And I thought it was very interesting, kind of the use of regression-based analysis, which is just a way of saying, look, if you're going to compare these things, you better control for the things that the demographic characteristics where we know there are differences before presenting just straight prevalence estimates. And so the punchline from that panel is really figuring out how do we interpret data. Similarly with the Medicaid analysis, a lot of times we think Medicaid, oh, that's our only source of data. But the use by Kim of both Medicaid and private data and what we can get as an additional factor on a particular impairment population. The use of private claims data is really, really important, particularly as we want to go to these impairment-specific groups, IDD, the deaf and hard of hearing community. Those are the groups, as we look to, those are the groups who really almost have to either go for special surveys or we have to go to administrative data to really start to begin to understand their individual circumstances, because they're not always represented because there's either not the question or not the sample in some of these national surveys. And the fourth thing is translation. And this gets to how we interact. And as we talk at a compendium, there's an irony that I'm sitting here talking because I think I'm learning from my own experience that it would be better to engage with you all and listen to what your needs are and have a dialogue as opposed to just sort of a summary presentation. I learned a lot during that session of things that we can do better in engaging the user community, including getting the user voice. And we're doing some of that directly with people with disabilities in our surveys, particularly in web-based surveys and where we're doing follow-ups, but also engaging you in conferences and having breakout sessions and having lunch with different groups where we can learn from one another is sort of like an area that we can get better. But I also want to come back to this final point of translation, which is as we think about the data, a lot of times it's hard to remember what all the charts and the bars said, but we can remember a personal story. So to the extent when you're researching something and that you can tell a personal story to put a face behind the data of whether there be employment gaps in a particular state, thinking about what might those gaps be. Maybe it's because there's a large number of people in a rural setting and taking somebody in a rural setting and saying, hey, look, this is what Joe person has to face in order to get to work. Packaging the disability statistics with that sort of qualitative finding is another way of translation that I think we can do better. So in terms of where to go, the compendium has continued to evolve over time. The very first version of the compendium didn't include state and county data for a number of reasons. The biggest one, it didn't really exist, and it was hard to produce and it was costly to produce. So that's the good news. We continue to evolve in this. But there's still going to be this need and reliance on admin data and pushing it to get to some of the questions that were asked today so that we can get to more specific impairment groups and so we can understand the ultimate heterogeneity behind the population. So, thank you very much. Oh, sorry, I should have closed. Sorry.